welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. The benefits of advanced MRI for patients with heart stiffening disease. An advanced form of cardiac MRI developed by academics at UCL in collaboration with the Royal Free Hospital has for the first time enabled clinicians to measure the effectiveness of chemotherapy in patients with a life-limiting condition, stiff heart syndrome. Researchers say that the breakthrough published in the European Heart Journal means doctors will now be able to better guide treatment strategies and by doing so, improve patients' prognosis. Assessing the condition has been difficult as while clinicians can detect the presence of amyloid in the heart, there has been no safe test to measure the amount. This has also meant there has been no way of measuring the therapeutic effect of chemotherapy, the normal first-line treatment. A patient's response is currently assessed with indirect biological markers, but these do not measure the amount or reduction of cardiac amyloid, the drug's ultimate target, and doctors find the markers less useful when trying to assess second-line chemotherapy treatments. Now, for the first time, they have used the technology to evaluate the success of chemotherapy treatment by assessing cardiac amyloid regression or progression. For the study, 176 patients with light chain cardiac amyloidosis had cardiovascular magnetic resonance with extracellular volume mapping. CMR scans with ECV mapping were done at diagnosis and then at 6, 12, and 24 months after starting chemotherapy. The advanced MRI technique allowed researchers to accurately measure the amount of amyloid protein in hearts and for the first time ever to measure the changes in response to chemotherapy on repeat scans. By measuring the changes, they could detect which patients would have a better or worse prognosis. Further, combining the results with blood tests for the disease, it was found almost 40% of patients had a substantial improvement or reduction in amyloid deposition, sometimes that was not thought to be possible before, showing how effective chemotherapy can be. The discovery of the sophisticated mechanism that bacteria use to resist antibiotics. Researchers have developed a significant and previously unknown mechanism that many bacteria use to resist antibiotics. Using a combination of computation and physical observation in the laboratory, the researchers have unraveled a sophisticated process that some commonly occurring bacteria use to save themselves from rifamycin class of antibiotics, which occur naturally and are also manufactured to treat infectious diseases. Rifamycins work by binding to RNA polymerase, a protein essential for bacterial life. The resistant bacteria, which occur widely in the environment and in some human pathogens, have developed a protein that can eject the antibiotic from RNA polymerase. Once the rifamycin is dislodged, they use specially adapted proteins to attack and destroy it. What we have discovered is a brand new trick up the sleeves of bacteria to evade this class of antibiotics, explains researchers Gary Wright, who leads the McMaster-based Global Nexus for Pandemics and Biological Threats. It's like a 1-2 punch. It's fascinating and it's so crafty. The discovery shows that the mechanisms of antimicrobial resistance or AMR are more complex and highly evolved than scientists had previously recognized. Now Wright and his colleagues are combining their database of tens of thousands of samples to see if other bacteria use parallel processes and whether they reveal vulnerabilities that can be exploited to create urgently needed new antibiotics. Their work is described in a paper published online in the influential journal Molecular Cell. Wright says that the discovery gives him with a new respect for nature's adaptability and renews his enthusiasm for finding and exposing other methods bacteria use to ensure their survival. AMR is a huge and growing global health concern that should be commanding much more attention and far more research resources, Wright says. Coming wave of opioid overdoses. Over the past 21 years of opioid overdose deaths, from prescription drugs to heroin to synthetic and semi-synthetic opioids such as fentanyl, geography has played a role in where opioid-involved overdose deaths have occurred, reports a new Northwestern medicine study. But the coming wave will not discriminate between rural and urban areas, the study findings suggest. Every type of country, from the most rural to the most urban, is predicted to see dramatic increases in deaths from opioid-involved overdoses, the study's author said. The study examined geographical trends in opioid-involved overdose deaths between 1999 and 2020 to determine if geography played a role in the three waves and the theorized fourth wave of America's opioid crisis. The authors used data recorded in the Centers for Disease Control and Prevention's Wonder database for 47 countries and county equivalents categorized on a 6-point urbanicity scale, most urban to most rural. While some researchers have looked at an acceleration rate from one year to the next, the study authors said, to their knowledge, no one has examined acceleration rates of opioid-involved overdose death rates systematically by geography for every year. The study authors examined toxicology reports and found people are using fentanyl, a synthetic opioid that is 50 to 100 times more potent than morphine, and carfentanil, a synthetic opioid approximately 100 times more potent than fentanyl, combined with meth and cocaine. The result is a powerful and lethal cocktail that can even evade from overdose reversing drugs like naloxone. The only path forward is the increased awareness and prevent opioid use disorders and to provide medication-assisted treatment that is culturally appropriate and non-stigmatizing in the rural communities, the authors noted. Mindfulness program which boosts pain regulation. Research at the University of Wisconsin-Madison's Center for Healthy Minds has isolated the changes in pain-related brain activity that follow mindfulness training, pointing a way toward more targeted and precise pain treatment. The study, published July 27th in the American Journal of Psychiatry, identified pathways in the brain specified to pain regulation on which activity is altered by the center's 8-week mindfulness-based stress reduction course. These changes were not seen in participants who took a similar course without the mindfulness instruction. Important new evidence that the brain changes are due to the mindfulness training itself, according to Joseph Belgoz, who's the study's author. Around 1/3 of Americans experience pain-related problems, but common treatments like medications and invasive procedures don't work for everyone, and according to Belgoz, have contributed to an epidemic of addiction to prescription and illicit drugs. To measure neural pain response, study participants had their brains scanned while receiving a carefully controlled heart-based stimulus on their forearm. The researchers recorded 2 brain-wide signatures of pain-related activity developed by collaborator Tor Wager, a professor of neuroscience at Dartmouth College. This innovative technique dramatically improves the ability to detect pain-related signals in the brain's complex activity. Changes in signatures can also be more easily interpreted in psychological terms. Participants in the MBSR course showed a reduction in a signature associated with the sensory intensity of pain. The study also looked at longer-term mindfulness training. Intriguingly, practice on intensive medication retreats was associated with changes in the neural signature for influences that shape pain indirectly. For example, differences in attention, beliefs, and expectations, factors that often increase the perceived levels of distress in non-meditators. These findings help show the potential for mindfulness practice as a lifestyle behavior. Thus, in addition to the insight it provides about mindfulness, the researchers believe that their study can also provide a model for future research, helping to untangle the complexity of pain and ultimately reduce the burden it places on our lives. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.